right. Welcome everyone to the Conscious Mental Health Podcast. I'm Laurel, your host for today. I'm a content developer with the Academy of Integrative Mental Health. And today my guest is Kelly Tuttle. Kelly is a nurse practitioner and the author of After the Crash, How to Keep Your Job, Stay in School, and Live Life After a Brain Injury. So we are going to be discussing how to work with clients and how to conceptualize that work for clients who are living with TBIs today. So welcome, Kelly. I'm so excited to get to hear your story and talk through with you and gain your expertise on this topic.
Well, thank you for having me. I'm excited to be here.
Yeah. Can you just start us out by telling us a little bit more about you and your story and how you came to do the work that you're doing right now?
Yeah, so my story begins with a car crash. I was driving home and a teenager pulled out in front of me suddenly, and I ended up T-boning her. And I thought I would just shake this crash off and go on with life, and I discovered that did not happen. And I struggled to get quote unquote back to my old life. And my biggest goal was to get back to work because I was a single income earner and benefit earner in my family. And I found some really wonderful books to help me recover from my brain injury and understand it, but nothing spoke about uh, really going back to work. I found a lot of information like for military people, young children, teenagers, athletes, people who had moderate to severe traumatic brain injuries. But it was hard for me to find information on an average Joe who was in a car accident who needed to get back to work. And so over the years, as I healed and I worked with various therapists and doctors and specialists, I finally was able to put together a tool bag to help support my return to work and to be as efficient and contributing member of my workforce as I could. And I didn't want other traumatic brain injury survivors to go through that anxiety and feeling lost. The biggest thing that I was searching for in the books that I read or listened to on Audible was I wanted hope. I wanted hope to know that things were going to get better. And I just wasn't finding that. And so a friend of mine said, "Hey, you should write a book." And I was like, "Whoa, yeah." And when I decided to write the book, I really wanted it to be a special niche for people like me who want to go back to school and go back to work after a traumatic brain injury or concussion and continue to do so while they're waiting for their brain to heal. So it was really important that my book shared my bag of tools that I had collected over the years and that it was quick to the point, go into the strategies, giving the list, giving things that you can do on your own, practical things, because sometimes also after a traumatic brain injury, there's a loss of work, which can include loss of health care. And so getting to a specialist may not be within your means until things get better. And so I really wanted practical things that someone can implement as they just kind of support themselves as time goes by and they heal. And it was important that I put it on Audible because when I had my traumatic brain injury, I went from being able to read several hours a day to only tolerating 5 to 10 minutes and just being totally exhausted, having a headache, dizzy, and struggling to remember the things that I did read. And what I had found out was that I had switched my learning mode with my brain injury from reading stuff to being able to learn through listening. And so it was really important that my book was in audible form, so those who are struggling with reading and memory, that they could listen to the book, and learn from it through that modality.
Yeah.
So
And I
that's my story.
Yeah, thank you so much. I really appreciate that. And what I really do or did enjoy about the book was a couple of things. First of all, that you are coming at it from both a professional but also a personal lens. So you have that personal experience, lived experience, but also that professional experience of working with patients, right? And so it really seemed like it was a bag of tools that not only worked for you, but for the patients that you worked with, and still do work with. And so I found that very encouraging and helpful. And I did always, throughout, appreciate how matter of fact and kind of to the point it was. It was very helpful to be able to see the breakdowns of strategies repeated multiple times, right? So that you could really come back to it and have it organized well and figure out which ones you wanted to try. And as a mental health professional, I thought it was really interesting that a lot of the tips and strategies you offered, I kept thinking, like, oh, these would be great for this client or that client, that to my knowledge have not had a TBI. But so I think while it certainly is geared toward that special niche population that you were really wanting to provide that service for, it can be helpful for a lot of folks experiencing similar symptoms. Um, and so for our listeners, very often who are our mental health professionals or in that mental health realm, right? What are some of the most foundational things for us to know, for our listeners to know about working with clients who have been diagnosed with a TBI, or who have possibly experienced a TBI, based on clinical history, even if a doctor hasn't suggested that in the past?
Yeah, so one of the important things that uh, professionals should know is that after a traumatic brain injury, people sometimes will lose their self-awareness. And that happened to me. And I've
Mm,
seen it in some of my patients. And when you have a client or a patient who's had a TBI and you are able to figure out if they do lack that self-awareness or just kind of be aware that they may not have self-awareness. And when I say self-awareness, this is just a terminology I use. Um, but the ability to know that there are cognitive problems, that there are emotional problems, to know your limits. Like when I had my traumatic brain injury, I was like, I'm going to shake this off. I'm going to continue to live my life the way I was living it. I'm going to go back to martial arts and start training for my third degree black belt test. And oh my gosh, wrong, wrong, wrong. That was wrong thinking. and I didn't realize um, that well, number one, I should not have been pushing myself that hard with exercise. And number two, that it was my concussion, my brain injury, that was keeping me from performing at the level that I wanted to perform. I just didn't know. And with that, knowing that your patient may possibly lack that self awareness, I always recommend with all my patients that they come into their appointments with a caregiver, a patient advocate who can help point out that um, some of the things that they're saying or they're doing aren't necessarily true, um, and really explain what's really going on. Like, they think they're doing okay, but the caregiver is seeing irritability and outbursts of anger, a change of personality, that kind of thing. So that's number one, realize that that may be going on. The other thing is the personality changes. And so for me, it was going from a type A to a type B personality. So I used to be the organizer, planner of my family. And once I had my traumatic brain injury, I turned into this really easygoing person who embraced procrastination, which was disastrous in my family because that's my husband's role. And so both of us were like sitting around not planning birthdays, not getting stuff done. And then when we realized the two of us were the same personality, we were able to work it through it. But realizing that the patient's personality has changed, that means their role in the family is going to change and that they're going to need family counseling around that and support. And then the other thing is that symptoms, head injury symptoms, will change over time for some individuals. Like if they suffer really bad headaches, like that's going to be their biggest complaint, the headaches, the headaches, the headaches. And then down the road, they may notice the cognitive challenges. So you'll really have to go back and follow up on them and do check-ins. Hey, what's going on? What has changed? What is, you know, talk to them and try to suss out things that are symptoms of their concussion that they may not realize. Or, they may develop anxiety or panic attacks 3 or 4 months down the road or 6 months down the road, that kind of thing. And
Mm.
then with the head injury, there could be loss of income. And so then there's that financial stress. So again, they're going to need that family counseling and working that out. They may need to talk to a financial planner um, because the budget has changed. The person with a traumatic brain injury may not be able to get their brain around the budget change if they were the bill payer. And then the other thing is you can get overwhelmed and not want to pay your bills. Like, for example, that was me. I would get overwhelmed with the mail. It would pile up, pile up. I would hide it in paper bags. And I worked with a speech therapist that helped me break the task down and to little tiny steps. And that's how I got through paying my bills. And then the biggest thing is that a traumatic brain injury person, once the dust has settled and it looks like there's going to be limitations, deficits in their life, that they need to let go and grieve the losses in their old self and embrace their new self. So,
Yeah.
mental health professionals have a lot of stuff that they can provide for people with traumatic brain injuries.
Yeah, it sounds like there's a lot of different things to unpack. I mean, just the idea of that sort of 180 flip of so many things that that person knows and just knows to be true about their life. I can only imagine the grief work that would go into but also the grief of the family unit, like to your point of really they, your family still had you, but there was a loss of this person that they had known for so many years and they had to kind of revisit, re-meet you. It sounds like in
Uh-huh.
many ways, and so that's all really helpful information to know. Especially because as a clinician, if someone were to come into my office and say, mm, I've been avoiding paying my bills. I've been keeping them in paper bags. I might, in my own bias, from my own bias lens, right, not think about that through a lens of, oh, do we have a brain injury going on? We might instead kind of go to what we know, which is anxiety, right, depression, and those things certainly are housed under that umbrella. But it sounds like it's really important to conceptualize it through this biological and structural lens as well. This certainly is a mental health, has mental health components, but is in many ways due to a structural change in the brain. And so I think that that's certainly something that's important to have a team of professionals wrapping around that person. Um, as I read through the book, I did notice how often these physical symptoms could directly lead to common symptoms of that we would know as mental health clinicians of anxiety, depression. Obviously, there's potential for PTSD symptoms,
Mm-hmm.
forgetfulness, freezing, maybe dissociation, self-esteem issues, and to your point, working with the grief. So there really is so much there. How can we improve? How do you feel like we can improve professionals' comfort levels and clinical competence in working with clients who have a TBI or who have potentially experienced something, a traumatic injury in that way, but are not considering this as a root cause of their symptoms?
Yeah, so I would it, what I what how I do it is that I first of all, you never want to blow off the fact that someone's had a traumatic brain injury and just say, oh, you just have anxiety. I think
Mm-hmm.
that it's real important to draw that bridge for the patient that you've had a brain injury, there's been cellular damage. This affects the processes of the brain and it causes various symptoms. And one of those symptoms is anxiety. And a lot of times, what I will say to my patients also is any kind of, I call it brain baggage. If you have Parkinson's, multiple sclerosis, epilepsy, traumatic brain injury, you are at higher risk of developing depression and anxiety. Of course, you folks already know that. So, really just putting down clear facts that it starts with this brain issue, whether it's Parkinson's or a traumatic brain injury, and that it affects the function of the brain, and therefore your neurotransmitters aren't going to be at the levels that they should be to make you feel normal or feel okay. And that's why you're having these symptoms of anxiety. Or, if it was a car accident, this is because of your car accident, traumatic brain injury, you're going to have this PTSD. You're going to have some anxiety around driving. And that's another thing, too, that's a big issue is anxiety around driving if they have survived a car accident. And then I forgot what was the other thing you were talking about.
No, no, I think that's like so much. There was a lot in my question. But I'm just, as a professional, I think, or like as a clinician in my field, we tend to just not look at that as like our first root cause. Like we think about other things, or we're taught to consider other things like the family system or perhaps genetics. Like, is anxiety, does that run in your family? Does other mental illness run in your family? But you know, very often I think even if it's part of our biopsychosocial assessment training, that might be one that folks skip over or sort of brush away. And maybe and that's certainly not what we should be doing. We should definitely be asking, because it really sounds like it's more common than most people realize, that these kinds of injuries can occur and really affect folks' well-being directly, without even maybe them realizing it all the way, that that's the at the root of it. They might just think like you, oh, I was in a car accident, I'm really tired, or of course I'm anxious, I was in this traumatic event, but they don't consider the brain changes, the neurotransmitters, the biology of it being a component of the mental health system. And I think like that's where the crossover is really important. So I appreciate you sharing that. Um, I'm curious from your perspective, because you do work with so many folks who now in your own career life and in your practice who have brain injuries, are the typical medications that are prescribed for, like, say, depression or anxiety, like, do those work for those folks frequently as well in helping them manage the symptoms, or are we talking about a totally different route when it comes to treating those symptoms from a brain injury standpoint?
That is a really good question. Now, I don't have practice experience with that.
Mm,
If my patients have symptoms of anxiety um, or depression, I refer them to psychiatry, and they manage
sure.
that.
Hmm.
But I can speak to myself that I've been treated with your typical SSRIs, and they have worked for
Hmm.
me.
Hmm.
And the my first line treatment for sleep issues, because the sleep there after a traumatic brain injury, you can have insomnia, you can have fragmented sleep disorders, you can have sleep apnea occur, and which I found really interesting when I was researching for my book. And so the baseline would be, to do a sleep apnea study to screen for that. And then I like to start off with a really low dose melatonin um, to help with it. I find it helps with both insomnia and fragmented sleep. And you could do a low dose starting with a sleep. And then if they wake up in the middle of the night, they can repeat that dose or half the dose. And that is helpful too. And then if they go beyond that and have difficulty with their sleep, then you may want to be thinking about a psychiatrist, because the treatment of those sleep disorders can be quite challenging.
Yeah, absolutely. And I appreciated the emphasis that you put in the book on sleep hygiene and valuing sleep because I'm sure you're aware, and our listeners are aware, especially if you live in the States, like, we do not value sleep
Yeah.
as a culture. And so I think it was important to hear you say in the book, it's okay to sleep. It's okay to take naps. It's okay to value that and really place priority on that because that's where your brain and your body are healing. There's that healing
Mm-hmm.
time. And so it sounds like it really can be tricky when you both are very fatigued often and need that sleep, so much more sleep. I know you mentioned in the book than maybe the average person who hasn't sustained a brain injury and also are having trouble sleeping. Like, that's got to be really tricky.
Yeah, yeah. And one of the books that I would recommend to your listeners, I don't know if you've heard about it, is called Why We Sleep. It's by Matthew Walker. He's a big
Mm,
sleep doctor. And so I would recommend reading his book. It's also on Audible, so if anyone wants to listen to it. But it
cool.
does speak to the importance of sleep. And it's a relatively easy book to read. Um, and so you could recommend it to a patient that you're trying to emphasize the importance of sleep if they are really late in their recovery of their traumatic brain injury. This is definitely someone who's high functioning that would be able to read it. Now, if they're early in their recovery or midway, it's too much uh, for them at that stage of their recovery to read something like that. But it's a really good book, and I would definitely recommend it.
Mm, cool. Thank you for that recommendation. We'll make sure to put that in the show notes for our listeners so that they can easily access that. And it sounds like that is a super helpful resource um, for anybody, just because we know that how important sleep is for mental health generally. So, yeah. What's the most challenging aspect of this work for you?
Well, I only get 20 minutes per patient. That's challenging. You
Mhm.
know, that so they need more time. Um, the other, it's challenging when they're not at that point of being aware or acknowledging that they've had a traumatic brain injury and that that's what's going on and causing their issues. And until they cross that bridge, it's you just kind of have to repeat, yeah, this is related to your brain injury or your concussion, your fall when you hit your head, and wait for them to come to the trough to drink that water you've been offering over time. So that's challenging also. And the other challenging thing, and it kind of just burns my bottom, is when doctors or any, people in healthcare don't acknowledge the effects and the devastation that a concussion or a traumatic brain injury has on a patient, and that you don't just get over it. There's some people who just don't get over it, and it affects them for the rest of their life. And I also don't think it should be treated as an acute issue like a cold, because a brain injury actually increases your risk of developing neurodegenerative diseases later on in life, like dementia. And so, if you have someone who's had a pretty good brain injury in their 30s, you want to keep that on the radar because you want to make sure this patient doesn't have additional head injuries, that their risk factors for stroke or vascular dementia are reduced. So you can maintain the integrity of their brain throughout their life and they can have a nice, enjoyable retirement later on in life. So,
Yeah, I would imagine. And that would, I'm sure, feel super frustrating, especially for somebody who's experienced that in their own life, like you have. And so just working to raise awareness and spread understanding is sounds like it's hugely crucial. Um, what are some ways that we can support folks in maintaining the integrity of their brain and their brain health, um, especially after a brain injury like that?
yeah, so we talked a little bit about the sleep.
Right.
So they should be getting about 7 to 9 hours of sleep at night.
Mhm.
Exercise, because exercise helps with the healing. It improves the circulation to the brain. A lot of times we think, oh, let's exercise for our heart, but the brain also has blood vessels in it too. And so that's really important. And um, mindful thinking is important too, because it helps with a lot of things. It helps with the healing process, the recovery from the brain injury. But mindful thinking also helps uh, maintaining the integrity of the brain. And one of the ways that is done is either through meditation or yoga. So there has been research that looked at people who practiced yoga throughout their lives, and they had less brain atrophy or shrinkage um, than folks when compared to folks who did not do yoga. So there's that component of exercise and that mindful thinking that is helps stave off the atrophy, which if you have brain atrophy, then increases your risk of dementia. So that's definitely
Mm.
something you want to avoid. And then nutrition is key. So a diet that's low in saturated fats and processed foods and so forth, because again, you're looking at supporting the vasculature of the brain. So whenever you think about like heart, eating foods that are healthy for the heart, the same for the brain. And it basically comes down to what your mom and dad said: eat your fruits and vegetables.
I can do that. I can do that. Yeah.
And so I often tell my patients, you want to eat closer to the ground and farther away from the factory. And so, like, an example is instead of drinking that glass of orange juice, rather eat the orange. Instead of putting olive oil on your salad, why not you eat the whole olive? That kind of thing.
Mm, I like that sort of motto to keep in mind. as a framework and a guide that's really simple and helpful to think about it that way. And it's, you know, I think it's interesting because a lot of those things, again, that you're talking about, making sure to prioritize mindful thinking, sleep, exercise and movement, making sure you're getting the proper nutrition. Those are also all things that, as an integrative mental health practitioner, I advise and recommend to my clients as well, right? For their overall health and for mental health. And so there is some great crossover there. And it sounds like there's a natural extension of the work that many of us are already doing to helping folks care for themselves and their brain health and the integrity of their brain. Um, it's just about bringing in that lens of, hey, we have to be extra thoughtful and intentional about this because you've had this brain injury happen.
Mm-hmm. Yeah, and then I'm sure you're aware of the gut biome connection and the vagus nerve, and so the gut and the brain, they talk like two little sisters during a sleepover all night long. They talk all the time. They're tight. And so
Yeah.
putting that nutritious food in there to help with that gut biome and gut health is so important to mental health and that brain connection. And we're even
Yeah.
finding that out with, I think they just had a research article come out about long COVID and
Mm.
how that COVID virus prevents the absorption of, I'm gonna forget the word, the thing that you get when you eat with turkey
Oh,
that makes you
tryptophan?
sleepy.
L-tryptophan?
Tryptophan. Yeah.
Yeah.
And
Mm-hmm.
tryptophan is needed to make serotonin throughout the body.
Mm-hmm.
And so that's why they're thinking a lot of people have these long COVID symptoms of brain fog and so forth because their gut lost the ability to process the tryptophan, which is a precursor to the serotonin. It's really fascinating. Now, how that's going to be treated down the road, they're not really sure, but it just speaks to the importance of the gut, maintaining the gut health to keep your brain healthy.
Mm. My mind is blown right now. I'm fascinated by that, and I'm gonna have to go find the research article. And I had I had read some things about long COVID and the brain fog, regarding inflammation and, in the
Yeah,
brain, and how obviously that gut biome and that brain connection, eating like a low inflammatory diet or focusing on
exactly.
those low inflammatory foods can really help with that as well. So I could definitely see how there's lots of crossover with all of these mental health symptoms and the health of your brain, obviously. But it's just interesting to know the specifics because I think that helps us give more concrete tools to our clients. So fascinating.
Yeah, yeah. The
Yeah.
whys and the whats to make it more concrete so that you can inspire them to take those steps, and not just poo-poo it off, like, oh, diet has nothing to do with my mental health. And it's like, oh no, it does. It does.
Oh, yeah, it
But
absolutely
convincing
does.
them it's hard. Yeah.
Hmm. Yeah, I think that's why it's really important. That's why as a mental health professional, I really try to practice from an integrative lens. And when I'm so appreciative of other folks who take that into consideration. And that's even part of why we do what we do at the Conscious Mental Health Podcast and the Academy. Like we're really trying to bridge all those gaps and help all professionals to come together to support folks' whole body and whole system, and thereby their mental health, which is part of that system. So super, super helpful. I'm curious as we're kind of talking through some of these things, what are what else do you wish that anyone living with a TBI or struggling with the symptoms of their TBI could know about themselves or about treatment or both?
Oh, let's see. Well, first of all, if you see a TBI patient, you've only seen one TBI. So everyone's response to a traumatic brain injury or concussion is as different as their personality. And so therefore the symptoms for each person is going to be different. And getting to know your symptoms and what triggers your symptoms is going to be key in you, first of all, being able to communicate to your health provider what you need. And two, to help prevent aggravation of those symptoms by limiting or avoiding those triggers. So that's really, really important. And then I mean, I'm a real big proponent of journaling because when you do have a traumatic brain injury, at least for me, it seems like you get trapped in your brain and you're just all alone with your thoughts, your negative thoughts, and they're just swirling around. And it's good to get it out on paper so you can see what these scary thoughts are. And once they're on paper, you can work through them. You can see, well, maybe they're not so scary, or, maybe this isn't set in reality. Or you can take the thought to your therapist or your psychiatrist and talk to them about it and see what they think and how they can help you with that. Or, you can share it with a trusted friend or family member, or you could just leave it there in the journal.
Yes, certainly that is an option, right? When we're
Yes.
journaling, sometimes that's the best thing to do is just let it be. But
Yeah.
it is nice to have a support to share it with if you do feel up to that. Yeah.
Yeah. And the journaling is not just getting those thoughts out. It's writing how your day went. Like today was a really bad day. I felt really grumpy. I wanted to snap so bad at my coworker because they came to my desk. And then you could think about it more and you can think, oh, maybe I probably was working too long. I should have taken a brain break. Or every time someone comes to my desk and interrupts me, it makes me just want to, I don't know, throw your keyboard or something. And then you
Mm-hmm.
realize you don't tolerate interruptions. You can't multitask. You need that time to transition from your work to switching your attention to a coworker. And then there's things that you can, once you identify those things, then you can go back and say, okay, I should take a brain break every 20 minutes. I should request my coworker, please don't come to my desk. Just send me a email or a message on whatever software messaging you have at your work. And that will allow you that transition time. And so identifying what your symptoms are and what you need can be done through that tool of journaling. And because brain injuries are so unique, it's really important that you seek that information so that you can get the care that you need to help you continue doing what you're doing, whether that's working or studying or running a business or whatever.
Mm. Yeah, I think that's helpful to recognize that this issue is not just like a bullet list of symptoms, that each experience can be, to your point, as unique as the person experiencing it. And so it's not even necessarily about looking out for specific things. To an extent, it's about exploring and being curious and asking the person what they're experiencing and helping them to identify the standouts for themselves and really empower them to build that self-awareness.
Yeah, because they may not, th- them being in the forest, they may not be able to know or figure out that they can't tolerate multitasking. But us as professionals can listen and say, okay, well, tell me what happened. Like I'll have a patient say, my family's talking to me and I'm unable to hear them. I think there's something wrong with my hearing. And I'll say, well, is there a TV on? is there music on? Are there loud noises? And they'll say yes. And I'll say, okay, probably what you're doing is your brain's having a hard time differentiating the noise. The brain after a brain injury can have hearing processing issues where instead of giving priority to someone speaking to you and blocking out the background, it gives priority to everything and you can't hear or understand anything. So then I would say what I would recommend is when you want to have a conversation with this person that you turn the TV off, you know, or go to a quiet space and have that conversation. And just kind of having to really suss out what the true issue is for that patient because they just may not have that ability. They don't, you know, have that ability to um, step away from that and identify, oh, every time I'm in a loud restaurant, I feel overwhelmed and anxious and I want to run out the door. When it turns out it's that they have sound sensitivity and they're overwhelmed with all the loud conversation, the music, and then the bar making margaritas, you know?
Yeah. Yeah, absolutely. I think that would be very overwhelming. But to have someone point out that that's even a possibility, maybe it's not just a flaw in you that you can't handle at restaurants. This is a
Yeah,
very real thing that can happen. Mhm.
yeah. And then it's important that that people around them, their caregivers, understand that it's not that they don't want to be social or go out. It's that they can't because their brain doesn't have the ability to filter out either the noise or the light or so forth. But there's tools you can use to help cope in those situations, like noise canceling headphones and wearing dark glasses if it's an environment where there's fluorescent lighting, such as in grocery stores. Grocery stores are a nightmare for people after a traumatic brain injury, just FYI.
That is helpful to know. And I could see that being true. But
Oh,
no, seriously, like,
yeah, it's terrible because, okay, you got the fluorescent lights, you got people walking around you, so you have the movement. So if they have eye tracking issues, they have to make a decision. So you're going to have decision fatigue. And if they struggle with their vision, they may not be able to see or find the things that they want on the counter. So they just want to turn around and go and run out the door because it's just so overwhelming.
sure. Oh, I can only imagine. And, I think it would be very easy if you weren't aware that all of these components are a possibility, that you would just chalk it up to social anxiety or, agoraphobia, that big old umbrella term that some folks love to use. But I mean, how could that not be an overwhelming experience for you if all of those brain processes are firing in that way? Oh, yeah. And then you have to be able to go to the grocery store where most people do. So
Yeah.
that affects all kinds of other areas of your life. And it sounds like it can really be a domino effect.
Yes, yes, it can. It even and also even just a mild traumatic brain injury. I speak mostly to mild traumatic brain injuries. Um,
Hmm.
it can devastate your life, because you could lose your job. It's going to affect your relationships. People have spiraled down to the getting in jail because they then get into alcohol and drugs to treat the symptoms, not realizing, that car accident, like 6 months or a year ago is causing these symptoms. And then, they're in jail. And I'd like to speak to people that it's important to keep on your radar that are at high risk of traumatic brain injury, and that would be people
Yeah.
that have been in prison,
Mm-hmm.
incarcerated, and your domestic violence survivors. They get
Mm-hmm.
missed a lot
Mm-hmm.
for having traumatic brain injuries.
Mm, yeah, I would imagine because it would be, I would think, so easy to chalk up their experiences to lots of other things. And
The abusive
yeah,
relationship and
right,
PTSD and all that stuff.
right.
But you forget that they've probably been hit in the face, they've been thrown to the
Hmm.
ground, they've been thrown up against walls, and so they may have had a history of multiple head injuries, and they are cumulative. The effects of the brain injury are cumulative. So, and then each time you have one, the recovery is longer and harder.
So it sounds like it's super important to prioritize asking that question as always, but especially with certain populations. Um, I'm wondering about, you know, you mentioned athletes at the beginning and folks who've been in the military. I'm wondering also about, people who are just like very adventurous and like to do lots of like high risk, like like paragliding and stuff, stuff like that. People that we wouldn't necessarily think about like, oh, a head injury. I think it sounds like, yeah, making sure to at least ask the question whenever you're working with someone and at least and rule it out or provide some psychoeducation on the possibility.
Mhm. Yeah, and you can't say, have you ever had a concussion or traumatic brain injury? Because a lot of people have them and they don't seek help or they're not diagnosed. I saw a patient, this was when I was in cardiology. I saw a patient, he'd been in a car accident and he was worried about um, his heart because of the impact of the airbags on his chest. And his complaint was fatigue, just being really, really tired. And I pointed out to him, well, you should probably see something about your concussion that you had from that car accident because of that whiplash effect slams the brain up against the skull back and forth. And your fatigue is most likely from that concussion that you had from
Yeah.
the car accident, not necessarily your heart. Of course, he had a stress test and it was normal, so it's easy to say, yeah, the heart looks good, but you
Hmm.
need to consider that in that car accident that you had a head injury, a concussion, a brain injury.
Yeah. Is there a window of time where that need has to be diagnosed, or can that be looked at a certain number of months or years later to determine? Um, how does that work, that process?
Um, there we don't know a lot about head injuries and brain injuries. And so, some would argue, well, I didn't see that patient at that time, so I can't say that is it. Um, and I can only speak to myself and my own practice and
Sure.
knowing that it does have impact, whether it was
Mhm.
6 months ago or a year or whatever. In fact, I had a patient who tried to kill himself and
Mhm.
had actually, after talking to him, had multiple head injuries, one in the military, and then
Mhm.
6 months before trying to kill himself, unalive himself, he had been in a horrible car accident where the car crashed into him and broke a
Mhm.
major bone. And the focus on his care was taking care of that major bone that had been shattered.
Sure.
And the head injury was never taken into account. And then he had anxiety and depression and then tried to end his life. And
Mhm.
that I relate to the head injury and not getting that treated and identifying that mental health issue that was going on. I'm sure he had some PTSD on top of it too. Now, I would go back and say, yeah, I think this is related to your brain injury. But some doctors would argue that no, you don't have proof of that
Mhm. Got it.
and not consider it.
Hmm. That has to be a little bit frustrating though, because I mean, from my perspective as a clinician, you know, I guess other people might disagree with me, certainly, but I think all things should be taken into consideration. We can trust our clients to be the expert on their own experience, so it has to be frustrating that that's discounted just because the
Yeah.
person wasn't there when it happened.
And that's the other thing too, is that you don't have to lose consciousness. You do not have to be hospitalized. You don't have to be in a coma. You can
Mm,
have a normal head CT and MRI and still suffer large consequences of a concussion or a brain injury, a mild traumatic brain injury. And so it's also um, important to educate people that concussions, mild traumatic brain injuries do not show up on the MRI scans. They only show gross abnormalities, right? They're only going to show bleeding, fractures, that masses, that kind of thing. But
mm,
the symptoms of a concussion or a traumatic brain injury come from the cellular level. And you could have diffuse axon damage, and you can have that cells die not only from the damage, but then the after effects of the biochemical cascade that of all those cells being lysed and destroyed and dumping all of their, chemicals into areas that they're not supposed to be, causing even more inflammation and damage.
mm. Gosh, is there a way that we have currently to assess or test for that process?
No.
Mm,
And we
mm,
don't eat, and there isn't even a guideline on how
mm,
to treat or care for or manage a mild traumatic brain injury. They're starting to look at it. They're trying to put them in categories and address the issues that way, because it really does come down to the symptoms and helping the patient manage those symptoms.
yeah. And that was one thing I appreciated in the book as well, is how you really walked through all of the different maybe referrals or specialists, different ways that you can come at this treatment process. And so, can you speak to that for our listeners a little bit about the different ways the different folks we can bring in maybe to approach treatment for someone who's experienced this? Because I could imagine, obviously, not all of these things are within my scope as a mental health professional, but I want to help be a guide to a client who may have experienced something like that and benefit from additional treatment. So, who do you typically recommend someone sees, or what what other treatment team of professionals would you like to see ideally for someone experiencing that?
Yeah, so that was really important for me to share too, with people, because the healthcare system, as you know, is quite complicated. And there's all these specialists, and you don't really know who to go to um, or to request to see. So one of the if your client is having cognitive issues, concentration, focus, being overwhelmed, procrastinating, unable to finish task, time management, plan, then I would recommend them seeing a speech therapist, because they help with a big load of those cognitive challenges, and they're very, very helpful. For the hearing sensitivity, yeah, I would, or hearing issues, I would definitely recommend a patient to be evaluated by an audiologist. And they can do I forgot what it's called. It's in my book, uh, loud sensitivity type study, where they
Mm,
can diagnose somebody with sound sensitivity. But your patient can also just invest in some noise canceling earbuds or headphones and realize that they have sound sensitivity, because they're going to immensely be immersed in like a pool of warm water. It's just so calming to take all that noise out. And they'll know right away if they're going to benefit from that. And then letting them know that to invest in the sound sensitivity that helps you control the amount of sound sensitivity. So there's earbuds and headphones that will connect to your cell phone that have an app where you can turn up and down that sound control too to allow
Mm.
for conversations. So you can wear your sound sensitivity headphones in a loud restaurant or on an airplane, and still it'll help you with your conversations with the people that you're with, um, so that you can actually focus in and onto the conversation and block out the background noises. So those are really helpful. And then if they have issues of headache, anxiety, neck pain, there's a lot of symptoms that could suggest that they have issues with their eyes not working well together. And if they're having difficulty with reading, if they find it uncomfortable to work on their laptop for a certain amount of time, then I would recommend them seeing a behavioral optometrist who can assess how well the eyes are working together to focus on an object, which is different than an optometrist that just looks at your eye acuity and your eye clarity and how clear you see the world. The behavioral optometrist is going to look at how well the brain visual systems are working together. And then if you have a patient who is struggling with fatigue, weight gain. They can't seem to build up muscle tone, strength, um, or exercise tolerance. You may want to consider them seeing a endocrinologist to see if they have had injury to the pituitary gland, which is at the bottom of the brain. That can be injured, and that affects how hormones are made, and then that can affect various issues in the body and the brain. And then I also support patients seeing acupuncturists or massage therapists and with help with their headaches and if they do have a significant whiplash. And then, of course, physical therapy if they have injuries, because if you break a leg or you injure your neck while you got your head injury, then that's going to affect your balance.
Yeah.
Uh, and then there's neurophysical therapists that can help you with your eye tracking. So the ability of the eyes to work and to focus and so forth can affect the ability for someone to be able to visually track something. And the neurotherapist can help with that. And symptoms that a patient will usually complain about are um, dizziness and nausea with driving or being a passenger, um, not being able to tolerate watching action films, where things move. Um, so that would kind of give you a clue that they would benefit from a neurotherapist.
Mm, that's super helpful. There are so many different components to this. I think it's really beneficial to even have a working knowledge of who you can go to for all of these
Yeah,
different puzzle pieces. Right.
yeah. And then I really discourage people to see neurologists. I know you think, oh, I hurt my brain, I should see a neurologist. Unless the neurologist specializes in traumatic brain injuries, I wouldn't recommend it. Most neurologists are general practitioners and they deal in diseases of the brain like ALS, Parkinson's, multiple sclerosis, that kind of thing, epilepsy. But a good person to go to is a physical medicine and rehab doctor, and they help with strokes, brain injuries, and spinal injuries. So they're really great. They're going to be the better person to see and get evaluated after a brain injury, and rather than a neurologist.
Mm, okay, that's a helpful distinction. And I think in the book, the rehabilitate is a physiatrist. Is that what
Yes,
their official
yeah.
title is?
They
Okay.
used to be physiatrists, but now they go by physical medicine rehab doctors.
Okay.
So
Okay.
PMR.
Okay, PMR. Okay, that's super helpful too, because again, those aren't things that I'm going to be working directly with a client on as a mental health professional, but certainly if someone has never experienced this before, they might not know the names of all of these folks. So super helpful for our listeners to know who to refer to in that way. Yeah.
Yeah, especially if your client goes, "Oh, I had this head injury and I saw this
Mm-hmm.
neurologist and he told me there was nothing to do and blew me off." And you're like, "Oh, well, you can look cool and say, 'Oh, no, you don't want to see a neurologist. You want to see a physical medicine rehab doctor.'"
Yes, I will be doing that at some point in my career. I imagine now this conversation will happen with somebody. So I appreciate that very much because I'm not a doctor, so I might think, oh, a neurologist, like you said, that sounds like
Yeah.
the right specialist to see. But I would imagine it's very discouraging to go to somebody who we think is really a specialist and they can't give us a lot of answers. So it's helpful to know that there are answers out there. Absolutely.
Yeah, it's just
So,
right. It's just knocking on the right door with the right symptom.
mm, mhm, which can be very tricky, as we know.
Yes.
So it's good to have some guidelines. Um, so as we start to sort of wrap up our conversation for today, I'm just curious, is there a practice that you can kind of share some wisdom on, or that you find really helpful in the work that you do that can kind of give our listeners a taste of how you work with patients from day to day?
I would say once your patient gets that self-awareness, then starting on the acceptance of the
Mm,
brain injury and journaling so that they can get to know the new person that they are is really important
yeah.
because I know for a fact, and I've heard my patients say this, is like after their head injury that that person they were died, they're gone. They're and they
Mm,
look in the mirror and they see the same person, but you're not the same person. You're changed. And so it's really important to get to know that new person, the new you, and embrace them and accept them and really look at um, what that new person now brings to the table as compared to the old person. Like I'm glad my head injury happened. I like the new me.
mm,
I used to be very goal oriented, get things done. Didn't take time to smell roses. Now I live a more simple, slower life, and I'm more grateful, and I'm appreciative, and I'm more patient. And I think it made me a better provider because I have a lot of empathy and patience and understanding. So there
mm.
are just seeing the new you and appreciating that your new you is important.
Gosh, yeah. That's so poignant and I'm sure in so many ways challenging and filled with grief, but also really beautiful. So thanks for
Yeah,
sharing that.
yeah.
Yeah. Well, the book, again, for our listeners is After the Crash: How to Keep Your Job, Stay in School, and Live Life After a Brain Injury. Kelly, thank you so much for joining us today to talk about all of these topics, and to talk about your book and your work. Where can folks find you if they're interested in learning more about you and the work that you do?
I you can go to my website, Kelly Tuttle .org, O-R-G, and I have a YouTube channel where I'm trying to post educational content for traumatic brain injury survivors. I make TikTok videos. I'm on Instagram and Facebook, and so you can reach out to me that way too. Send me a direct message, and I would love to hear from anybody who has any questions.
Oh, that's so wonderful. What's your TikTok or Instagram handle? And we'll make sure to put it in the notes so folks can find you. Do you remember? Do you
Ooh,
remember?
not really.
That's okay. You
I
can
think
give it to
I'm,
me. Yeah.
yeah, I think I'm brain lower dash NP on Instagram
Okay.
and Facebook, I think just Kelly Tuttle, but I don't know. Yeah, we'll
Okay.
have to put it in the show
Yeah.
notes.
We'll put it, no worries. You are not I wouldn't remember mine half the time either, because who pays attention to their own handle? Not me.
Yeah.
So we'll get that from you, and we'll put that absolutely in the show notes for folks to see and to click on and to check out. Oh, my dog decided to join us at the end of our conversation to check out more of the work that you do. And I'm just so grateful for your wisdom and your time. Thank you so, so much.
Well, thank you for having me and allowing me to talk to your listeners and share my story.
Absolutely. Absolutely. Oh, again, my dog really wants to be part of this episode. Thanks, Kelly. We'll talk soon.
All right. Bye-bye.
Okay, bye.